Today, I get to be the bearer of good news. And I mean real dollars in your Social Security check good news. There are 4 federal programs that pay Medicare costs for people on modest incomes. They've existed for decades. And the government's own numbers say millions of people who qualify have simply never applied. Nobody mails you an invitation. So consider this video your invitation. Education, not advice, sources on screen, and one warning up front. The limits I'll give are the 2026 federal baselines. A number of states are more generous. So if you're close to a line, apply anyway and let the office decide. Start with the big idea. You know that $202.90 Part B premium that comes out of every Social Security check every month, the one we talked about in our first video? For millions of people, a program exists that pays that premium for you. Your Social Security check literally goes up by $202.90 a month. Over $2,400 a year because the deduction stops. That's not a discount program or a coupon. The state starts paying your premium and your full check arrives. The programs are called Medicare Savings Programs, and there are 3 main flavors sorted by income. The first and most generous is QMB, the Qualified Medicare Beneficiary Program. For 2026, the federal income line is about $1,350 a month for a single person, about $1,824 for a couple. QMB pays your Part B premium, and then it keeps going. It pays Medicare's deductibles, coinsurance, and copays too. Providers aren't allowed to bill QMB members for Medicare cost sharing at all. For someone on a tight income with real health needs, QMB can be worth thousands a year beyond the premium itself. Second, SLMB, for incomes up to about $1,616 single or $2,184 for a couple. SLMB pays the Part B premium. That's the $2,400 a year raised to your check. Third, QI, qualifying individual, for incomes up to about $1,816 single, $2,455 couple. Same prize, the Part B premium, paid for you. QI runs on annual funding and is granted first come, first served, which is one more reason not to wait around. All 3 also look at assets, and this is where people wrongly count themselves out. The 2026 federal resource limits are $9,950 for a single person, $14,910 for a couple. But here what doesn't count, your home doesn't count. One car doesn't count. Your furniture, wedding rings, burial plot, none of it counts. The limit is about money in the bank and investments, not your life. And several states raise these limits or waive them entirely. Let the office do the math, not your assumptions. Now, program number 4, and it stacks on top. Extra Help, the federal subsidy for Part D prescription drug costs. Social Security itself estimates Extra Help is worth about $5,700 a year. It wipes out the drug plan deductible and caps your co-pays at small fixed amounts, a few dollars per prescription. For 2026, the income limit is about $23,940 for a single person, around $32,460 for a couple, with its own higher asset limits. And here's the quiet rule that ties this all together. Qualify for any Medicare savings program, and you're automatically enrolled in Extra Help. 1 application, 2 programs. The premium refund and the drug coverage together. So who actually fits these lines? More people than you'd think. A widow living mostly on a Social Security check. A couple where one spouse retired early on a small pension. A neighbor who never mentions that money is tight. The government's own studies have found that millions of eligible seniors never enroll. Partly because of pride, mostly because nobody told them. If these limits aren't your situation, I'd ask you to do one thing anyway. Think of one person they might fit and send them this video. This series is called What You're Owed for a Reason. How to apply concretely. The Medicare savings programs run through your state Medicaid office, and you can start at Medicare. Gov by searching Medicare savings programs, or just call your state's office directly. Extra Help runs through Social Security online at SSA, Gov by phone or in person. And if forms aren't your thing, every state has SHIP counselors, free, trained, selling nothing, who will sit with you and fill out every line. Bring your income figures, your bank balances, and your Medicare card. That's the whole kit. One honest caution: these are means-tested programs, so report changes honestly and expect a renewal check-in. The paperwork is real, but it's once a year, and the people at SHIP do this all day. 1-minute recap. 3 Medicare savings programs, QMB, SLMB, and QI. Pay your $202.90 Part B premium, with QMB also wiping out deductibles and copays. 2026 federal lines run from about $1,350 to about $1,816 a month for singles, roughly $9,950 in countable assets. And your house and car don't count. Extra help adds around $5,700 a year of prescription savings at higher income limits, and any MSP enrolls you in it automatically. Apply through your state Medicaid office and SSA, Gov, or let a free SHIP counselor do it with you. And if it's not for you, it's for someone you know. Next video, the 5 retirement money mistakes we see over and over in the fine print, and the fix for each one, including a couple you can still fix this week, whatever your age. See you there.